Hello. Our topic today is not about COVID-19, but about some unintended consequences of the virus that is equally and sometimes more important, and that is taking care of your healthcare needs. So with me today is Dr. Chris Udovich, Chief Medical Officer at Silver Cross Hospital and practicing family physician at Hedges Clinic. Because of COVID, many people have been afraid of coming to the hospital or going to a physician's office and doing the things they need to do to stay healthy. And frankly, at the beginning of the virus, we told people to stay home. But what's happened as a result of that message?
Sure.
Chris?
Thanks for having me today. So what you might expect is that we've seen a big drop-off in patients coming to the hospital or to the clinic. Now, certainly that's very understandable. At first, it was very uncertain what the virus was, how it was transmitted. There was a lot of confusion about how quickly it was going. So what we found is a lot of people didn't go to their hospitals or their clinics. For example, in April, we saw about a third or 30% decrease in the amount of people seeking care. And in May, it was up to 50%. So that's pretty significant. Emergency room visits were down nearly 40%, period. And 1 out of 10 people basically were not seeking the care and had worsening outcomes because of them not seeking the care that they needed.
Well, do you have some examples of that? It
Sure.
sounds dangerous.
It is. So what we've seen is what would be normal routine conditions that we take care of relatively easy, but got serious in the short term, such as people with abdominal infections that we might be able to treat with an antibiotic in the clinic or at the hospital emergency room that were delayed and they had to be admitted to the hospital and needed surgery. We see people who didn't present to the emergency room because of stroke symptoms or heart symptoms, and they had really bad outcomes because of not presenting and us taking interventions easier and quicker.
So we've taken many precautions here at the hospital. So if people do need to come here, that they feel safe. What would be some things that we've done to reassure people that if they need to come here, they will be safe?
Sure. So I think the message is if you need to come to the hospital, see your doctor, it is safe. We've taken a number of precautions. We followed CDC and Illinois Department of Public Health guidelines, visitor restrictions, masking, hand hygiene, exposure prophylaxis. We've done a number of things that make sure that people, when they come to the hospital, they are safe.
We've isolated in the emergency room if someone presents with symptoms.
Right.
We've isolated on the floor so that people are not commingled with those who do have COVID-19 disease.
True. We separated them. We had special rooms for these patients, be it up on our 6th floor or other parts of the hospital that are negative pressure, and even in the ICU. Right. So we've taken extreme precautions, and it's really helped us.
And now we have thermometers at entrances, so all of our employees get their temperatures taken, and now visitors will as well. We were doing that before, but now it's digital. It's
high tech.
It's very high tech.
Yes.
High tech. Well, maybe it's a good idea to review when should somebody go to an emergency room, when should they go to urgent care, when should they call the doctor office.
Sure.
You want to kind of go through that?
Sure. So I think where possible, you really should call your physician or primary care doctor first to help guide you. If you don't have one, we certainly have some internet tools like Silver Cross Connections that can help you go online and kind of guide you to what care you should take. Rule of thumb is to the emergency room. It's really a life-threatening condition, okay? Such thing as abdominal pain, bleeding that won't stop, chest pain, extensive cuts or lacerations, a fever in somebody who's under 3 weeks old, in the infants, fainting with loss of consciousness, things of that regard. So life-threatening emergencies that really can't be delayed, go to the emergency room. Urgent care really more is the minor stuff. So people may be an asthma exacerbation, kind of a cough, urinary tracts are very common there. Maybe a sports injury where you twist your ankle and you want to get evaluated and you don't see any bones sticking through the skin, things of that regard. Calling your doctor's office for routine care is always a good idea at this point as well. So a lot of offices have also taken a lot of precautions to make sure that they're separating well visits from sick visits. I know, for example, at Hedges, We do our wellness visits all in the morning, and if there's any sick visits, we're doing it later in the day. So we're separating them out, and we have people who have sick visits go to certain parts of the clinic to separate from the well visits. Like Silver Cross, a lot of clinics, including our own, have people up at the front before people even come to the building, asking questions and screening and taking temperatures.
So a lot of precautions.
A lot of precautions. So don't delay your care. It is safe.
Yeah. And we have some good news here at Silver Cross also. On July 6th, we'll be opening a new urgent care center right on this campus. The hours will be 9 a to 9 p. So when people are coming and seeking care, they can make a quick decision. Should I go to urgent care? Is it on the list that Chris just mentioned? Or should I be heading for the emergency room? So that will be very helpful as well.
Urgent cares are great. If you don't need true emergent care, the urgent care is typically a little quicker and less expensive. So it's the right care at the right place and the right time.
Exactly. And I know Hedges had after hours and Silver Cross had after hours on Essington. Those are closed right now, but probably in the near future we'll be reopening again.
Yeah, we're starting to see business ramp back up.
Yeah.
Patients are coming in and feeling much more comfortable as we're getting the message out. So, yes, urgent care will be coming back in full swing.
Right. So you mentioned using technology, and we put something new on the Silver Cross website. It's called Care Connect. What's that for?
So Care Connect, for example, if you don't have a primary care doc and you're a little confused as to what should I be doing with the symptoms that I have, it's a nice based internet tool to go on, type in your symptoms. It kind of gives you an idea, a recommendation. Okay, should you be seeing something in the emergency room? Should you go to urgent care? Should you do a telephone visit with a nurse practitioner to get your care taken care of right away? So really help guiding right care, right place, right time.
My husband had an issue over the weekend, and he really did not want to call his primary care physician on a Sunday evening. So he went on Care Connect, and it was fabulous. A series of questions, and it doesn't give you a diagnosis, but it ends up giving you a recommendation saying, it could be this, it could be this, and you should do X. And in his case, X was talk to your doctor on Monday.
Yeah.
Yeah, because it wasn't urgent, even though he might have thought that it was. So really helpful tool, because sometimes it's scary. You just don't know where to go or what to do. Well, Chris, why don't we sum up with what can people do to stay healthy so that they don't need to see a doctor or come to the emergency room?
Absolutely. Well, take care of yourself, okay? So, eat well, get your exercise, try to be social, mostly through telecommunications. I know I've done a lot of YouTubing, a lot of FaceTiming with my parents when they were in Florida, my sisters in Washington, D.C., my brother out in California. So really try to keep those social interactions going. Try to get outside. Try to be active. I can't tell you how many patients I've seen in the clinic that have worsening anxiety or their diabetes got a little bit worse. The simple things like eating well, sleeping well, getting out, doing exercise, and doing the social interactions helps immensely to that and will make you feel better.
Right. And we still want to wear our masks and social distance and use good hand hygiene and be careful. So thank you, Dr. Udovich, for being here with me today.
Thank you.